welcome back to Body Beautiful. I'm Janelle Marie. Today we are talking about all kinds of cosmetic procedures. I'm here with plastic surgeon Dr. Joseph Mealy, and we're talking about breast aug. Now we're talking about mommy makeovers. So let's start with mommy makeovers, because I know everybody thinks that, hey, do I have to be a mommy to have a mommy makeover? Is that a certain thing? You know, what is that? And it can put people off because it's like, well, I don't fall into that category.
Exactly.
So help us out.
No, it came about because frequently with pregnancy, the breasts and the belly take a hit. So either the size of the breasts change or they're sagging, and the belly can get stretched out. So we would frequently do procedures together to fix both areas, and it just came to be known as mommy makeover because it's alliterative, it sounds nice.
So you can do a whole bunch of procedures all at once.
You can.
And can you do them one at a time?
You can.
Oh, so it doesn't all have to be done
together. Yeah, sometimes we'll stage them. I think with the breasts, it can be anything from lifts to augmentation to a combination of the two, and in some cases even reductions. Sometimes the breasts get bigger with pregnancy or weight gain or loss. And with the belly, it can be anything from liposuction to tummy tucks and everything in between. But you don't have to be a mommy. I do the same procedure often for people who've lost a lot of weight.
Oh, yes. Have the weight loss surgery probably is a big one.
All right. Similar problems. Similar areas get bigger and smaller, and then we lose that support from the fat.
Skin.
Yeah.
Picture number one, what are we looking at?
So this is a mommy makeover. So this is someone who had a breast aug lift with a tummy tuck.
That's very nice.
So you can see the belly, it's sort of like there's something sticking out at the middle.
Right.
Because the muscles have been separated. They get pulled apart by the pregnancy.
Gotcha.
And then during the tummy tuck, we're repairing the muscle as our foundation, taking off extra skin. And if there's a little fat at the bottom, that goes away with the skin also.
So you do a little liposuction maybe just to clean things up, but you actually sew the muscles back together.
Yes.
Like a corset almost?
Like an internal corset, exactly.
Fantastic. And what on this surgery, what was the recovery time?
So recovery time, mostly it's due to the tummy tuck, because when we repair that muscle, it's sore. It may be hard to get up from sitting or standing for the first couple of days. Usually, though, once people are up, they feel good.
Really?
So a lot of patients will get up and then they'll stay up for a while just because it feels nice to walk.
And you have some nice tight abs.
Well, you do. Plus, it prevents complications. We worry about people sitting still getting pneumonia or blood clots. So if you're up moving, you're less likely to have trouble.
Picture number two.
So similar here. So this is someone who had a tummy tuck, and it's fairly recent. So you can see where the incision is along the bottom. And then in terms of the muscle repair, you can see that it brings all the abdomen back. She really isn't fat. She doesn't have a lot of fat. She doesn't have a lot of loose skin hanging over. Primarily for her, it was a lot of laxity of the muscle. And
in some cases, you can liposuction the fat out and then maybe enhance other areas of the body? Maybe do
So sometimes we'll move fat from the belly or the flanks, that lower back, and use it for buttocks augmentation.
I like that.
Yeah,
Brazilian butt lift.
Many people do like that.
All right, I have an email question for you.
Okay.
This is a big question on the mommy makeover. Can I have kids once I get a mommy makeover? Let's say, I'm not done having children and I didn't know that. Can I have kids?
Well, sometimes people do change their minds. I mean, in general, we like to be done with the childbearing so that things get fixed and they stay fixed.
But you never know.
But if pregnancy occurs, you certainly can get pregnant. It won't stop you. But it may change the results.
Gotcha.
So the breast may get bigger and droop or change size. The belly may get stretched out again.
So just take it case by case.
Exactly.
Go back in. All right, picture number three.
So this is someone you can see has a lot of loose skin, even up onto the sides.
Yeah.
So in these cases, I will extend the tummy tuck farther around.
Oh, really? Okay.
The ultimate extension is all the way around, which would be a body lift.
Oh, okay.
Right. So we'll do that when the buttocks are sagging and there's a lot of loose skin on the back.
Oh, that's nice.
But usually you can get up there and kind of recruit that skin and get rid of what's extra.
So you can almost do the whole body lift, but not really. I mean, that's kind of nice that you don't go all the way around, but it still has that effect, maybe?
If the problem is on the sides, then we just go to the sides.
Okay.
If it's around to the back, then we got to go all the way around to the back.
Fantastic.
But again, the muscle you can see is repaired. That lower skin that was sort of redundant at the bottom has been removed, and the fat that's in there gets removed with it. And often in these cases, I will do some liposuction on the lower back or the sides to keep everything in proportion. Because we want the front looking good, we want the back to match.
And those scars are underneath the so they don't show if you're wearing a bikini? Or?
Yes, so they should be below the belt line.
Oh, that's good.
When there's a lot of loose skin like this, it does make it harder.
Yeah.
Because the skin is not as reproducible in terms of the final result.
But ultimately, the scars will fade, correct?
Yes.
Okay. Last picture.
So same thing here, just a lot of laxity in that lower part of the abdomen, some laxity in the breasts. In this case, she was happy with the size of the breast. So when she was wearing a bra, the size was good.
Right.
So essentially, I just did a lift, no implant.
Oh, okay.
And then tightened up the belly.
So if somebody has implants already and they come in for a mommy makeover, can they get the mommy makeover? What happens if you already have the implants?
Sure, and again, if you're happy with the size, we can use the implants that are there.
Okay.
If they're older implants, sometimes we'll want to replace them since we're in there, especially if they're pre-94. those are more likely to cause trouble, I would say.
And then what's your most common mommy makeover? The most common that women come in for?
Breast dog, tummy tuck.
Breast dog and tummy tuck, that's it?
That's the most common.
All right, so if you add other things, you can do them at different times. You can do them all together.
Yes.
It
depends on the health and how long the procedure is going to take.
Gotcha.
And obviously, we don't want to do too much at one time.
Exactly.
But a lot of times we're combining them just so you have one recovery period.
Sounds great, Mommy Makeovers. All right, for more information about Dr. Mealy, you can call the office 925-943-6353 or check them out on the web, drmealy.com or sanfranciscobreast.com. Remember, all the before and after pictures will be there.
And more.
And more, lots more. You've got great websites because you cover every angle.
I try.
It's fantastic.
It's there for information.
Dr. Joseph Mealy, we will be right back with you. Stay right here on Body Beautiful.